Every year, millions of seniors go in for routine medical tests, just like they're told. You trust your doctor. You want to stay on top of your health. And you believe that catching things early is always a good thing, right? But what if I told you that some of the very tests meant to protect you could actually put you at risk? Sounds dramatic? Maybe. But it's not a scare tactic. It's a wake-up call. See, after the age of 60, your body responds differently. What used to be no big deal in your 40s might now be the tipping point toward a serious complication. A scan, a shot of contrast dye, even just walking on a treadmill. Simple steps in a routine exam can quietly trigger chain reactions inside the body. Not always, but often enough to pay attention. Because instead of walking out of your checkup feeling reassured, you might find yourself dizzy, disoriented, or worse, within hours. And that's what this video is about. Giving you the questions to ask, so you don't just do what's routine. You do what's right for you. So before your next test, let's make sure it's not just a box to check, but a decision you fully understand. Are you ready to find out what no brochure will tell you? In the next few minutes, we're going to look at 5 routine medical tests that are commonly recommended for adults over 60. On the surface, these tests seem helpful, even necessary. But under certain conditions, they may carry risks that aren't always discussed in the exam room. This isn't about fear. It's about preparation. Because instead of assuming that every test is harmless, we should be asking, is this the right choice for someone in my condition, at my age, with my history? Rather than going along with what's scheduled, you deserve to understand what's truly essential and what might do more harm than good. We'll walk through each test, show you real-life cases, explain what the research says, and most importantly, give you the right questions to ask your doctor before agreeing. Because protecting your health doesn't always mean doing more. Sometimes it means knowing when to pause. Let's start with a test you've probably heard of, or maybe even had. The CT scan with contrast dye. If you've ever had one, you might remember that warm, flushed feeling that spreads through your body when the dye is injected. It's quick. It's routine. And your doctor might have said, "Don't worry. It just helps the images come out clearer." But here's the part no one talks about. That little shot of contrast dye isn't just helping the picture. It's also putting your cardiovascular system under pressure. Especially if you're over 60, have high blood pressure, kidney issues, or heart concerns. Now, why does this matter? Because for some people, the contrast can trigger what's called a vasovagal reaction. Your heart rate drops, your blood pressure falls. You might feel dizzy or nauseous. In rare cases, people faint. But in other cases, the opposite happens. Blood pressure spikes. Blood vessels tighten or spasm. And when that happens, particularly in the brain, there's a real risk of a clot forming or a vessel rupturing. Here's a story that drives it home. An 81-year-old man went in for a routine abdominal CT scan. Just a precaution. The scan was clear. He felt fine. But 2 days later, he had a minor stroke. Doctors suspect the contrast injection caused a temporary surge in his blood pressure, which led to a clot traveling to his brain. Nothing else had changed in his health. Just the scan. And this isn't just one case. A study published in the Journal of Vascular and Interventional Radiology found that seniors who underwent contrast-enhanced CT scans had a significantly higher rate of vascular complications within 72 hours, especially if they had pre-existing hypertension, cardiovascular disease, or kidney problems. The risk isn't in the scan itself, it's in how your body reacts afterward, especially a body that's already under stress. So what can you do? Before you agree to a CT scan with contrast, ask your doctor, is the contrast truly necessary? Often, a non-contrast CT or even an ultrasound can give enough information, especially if you're not dealing with a life-threatening emergency. And don't assume your doctor knows your full story. Speak up. Let them know if you have high blood pressure, kidney concerns, or if you've reacted poorly to other imaging tests. It's not about saying no to every test. It's about making sure every test fits you, your age, your history, your needs. Because instead of walking out reassured, the last thing you want is to walk out at risk. Now, let's talk about the stress test, often called the treadmill test. On paper, it sounds like a smart way to check your heart. You walk on a treadmill while hooked up to monitors. Your doctor watches how your heart responds under pressure. But here's the part that's often left out. For people over 60, especially those with high blood pressure or heart disease, this routine test can push your body further than it should go. Why? Because as the treadmill speeds up, so does your heart. Your blood pressure climbs. Your vessels expand and contract quickly. And suddenly, your cardiovascular system, already managing age-related changes, is under a kind of stress it might not be ready for. Now, you might say, but they monitor everything, don't they? Yes, they do. But not everything can be predicted or caught in time. Take Margaret, one of our subscribers from Ohio. She's 74, has lived with high blood pressure for years, and felt just fine going in for a treadmill stress test. Her doctor said it was just a precaution. Halfway through the test, she felt tightness in her chest and got dizzy. They stopped the test. She went home, shaken but stable. The next morning, she had a minor stroke. Doctors believe the test triggered a spike in blood pressure that ruptured a small vessel in her brain. Now, was it the test that caused the stroke? Not directly. But the test introduced just enough strain to a fragile system. And that's what tipped the balance. This isn't a rare case. A 2020 study in the American Journal of Cardiology followed over 2,300 adults over 65 who underwent treadmill stress tests. Nearly 7% experienced harmful events, blood pressure spikes, irregular heartbeats, dizziness during the test. And the most affected were those who already had vascular issues. So, what's the alternative? Instead of jumping on a treadmill, ask your doctor about safer options. There's the nuclear stress test, which uses medication to mimic exercise, or a resting echocardiogram, which lets your doctor see how your heart works without pushing your body into overdrive. And if you're not experiencing symptoms, no chest pain, no fatigue, ask, is this test really necessary now, or can we wait? Because instead of proving you're healthy, a poorly timed stress test could create the very problem it's trying to prevent. Protecting your heart means asking the right questions, not just following the protocol. Let's move to something even more common, especially after 60, the endoscopy. Whether it's a colonoscopy, an upper GI check, or something in between, doctors often recommend it just to be safe. And sometimes it's absolutely necessary. But here's the part to pay close attention to. If you're over 60, especially if you're taking blood thinners like aspirin, warfarin, or Plavix, adding sedation to the mix can quietly introduce risks that no one talks about at check-in. Here's why. During sedation, your blood pressure tends to drop. Your breathing may slow. Combine that with medication that thins your blood, and suddenly, you're more vulnerable to internal bleeding, clots moving through weakened vessels, or even silent strokes. And the worst part? You may not feel anything right away. A study published in Gastrointestinal Endoscopy in 2021 found that among patients over 65 who had sedated endoscopies, there was a notable spike in transient ischemic attacks, or mini-strokes, within the first 72 hours. These events weren't catastrophic, but they were clear signs that something had disrupted the brain's blood flow. Let me tell you about Elaine. She's 76, healthy, no symptoms. Her doctor suggested a routine colonoscopy with sedation. 2 days later, she began slurring her speech. Her balance was off. The ER confirmed she had a mild stroke. What likely happened? The sedation lowered her blood pressure just enough. Her daily aspirin prevented normal clotting, and together, it created a perfect storm for something to go wrong. So what should you do? Ask the right questions before you agree to the procedure. Start with, do I really need this test now? Or are there alternatives? And then, can we do this without sedation? Or with a lighter option? And most importantly, do I need to adjust my blood thinner before the test? Because instead of walking in for something routine, you deserve to walk in informed. The goal is not to avoid endoscopy forever. It's to make sure it's done at the right time, in the safest way, for your body. Now, let's talk about the MRI. A test that sounds completely safe. No radiation, no needles during the scan, just a big machine taking pictures. And most of the time, that's true. But when contrast dye is added, especially gadolinium, that's when older adults need to pay closer attention. Why? Because gadolinium is a heavy metal. It's used in contrast MRIs to make blood vessels, organs, and tissues more visible. But here's the catch. After 60, your kidneys naturally slow down. And if you already have mild or undiagnosed kidney issues, your body might not flush that metal out as efficiently. So what happens next? In some cases, small amounts of gadolinium can linger in the brain or other tissues. We're not talking about a major dose, just trace levels. But over time, those traces may add up. A study published in Radiology tracked more than 2,000 patients over 65 who received gadolinium-enhanced MRIs. Within a week, about 5% reported neurological symptoms: headaches, dizziness, blurred vision, or feeling mentally foggy. Most had underlying kidney problems, diagnosed or not. One man, Harold, 79, from Arizona, went in for a back MRI with contrast. He had no idea his kidneys were weakened. 2 days later, he felt disoriented, weak, and confused. It took nearly a week for the symptoms to clear. Only then did his doctor check his kidney function and found stage 3 chronic kidney disease. He told us, "No one warned me. Had I known, I would have asked." That's the part that matters. Instead of assuming every contrast MRI is safe for everyone, the smarter move is to ask, can we do this without contrast? Often, the answer is yes. If contrast is necessary, request a simple kidney function test first. It's called a GFR test. Takes minutes, gives peace of mind. And if you've ever felt off after a scan, even slightly, mention that. The more your doctor knows, the better they can protect you. Remember, the MRI itself isn't the danger. It's the extra chemicals your body may not process the same way it did 20 years ago. So instead of walking in thinking, this is just a picture, you'll walk in prepared, protected, and fully informed. Here's a test that seems like the safest of all. No needles, no dyes, no noise. Just a simple scan of your neck arteries. It's called a carotid ultrasound. Doctors often recommend it for people over 60, even if you feel fine. Just to be thorough. But here's what they rarely explain. If you don't have symptoms, no dizziness, no vision changes, no weakness, this scan might lead you down a path that's more dangerous than the condition itself. Why? Because as we age, some plaque buildup in the carotid arteries is normal. A narrowing of 40%, 50%, even 60% isn't always cause for alarm. But once that shows up on a scan, some doctors quickly refer patients to vascular surgeons. And suddenly, you're being told you may need a stent or surgery to clear the blockage, even if you've never had a single symptom. Sounds proactive, right? But here's the problem. A major study published in the New England Journal of Medicine followed over 3,000 seniors with moderate carotid narrowing but no symptoms. The researchers found that surgery did not reduce the risk of stroke significantly more than medication and lifestyle changes. In fact, a small number of patients had strokes as a direct result of the surgery itself, either during the procedure or during recovery. Let's go back to Helen, 82, from Pennsylvania. She felt great. No warning signs. Her doctor ordered a carotid scan just to be safe. It showed 65% narrowing. A few weeks later, she was on the operating table. During the procedure, she suffered a small stroke. She survived, but now lives with partial weakness on her right side. She told us, "If I'd known there was another option, I would have waited." So what should you do? If your doctor suggests a carotid ultrasound and you have no symptoms, ask, "What are we looking for? And what will we do if we find it?" If the answer is just to check, that's not enough. Because instead of jumping to surgery, there may be better paths, like adjusting your medication, improving your blood pressure, or simply monitoring over time. And if you've already had a scan that showed some narrowing, don't panic. Ask about repeat scans. Get a second opinion. Ask if medication alone is enough right now. Because sometimes doing nothing is actually the safer choice. So, what's the real takeaway here? It's not that medical tests are bad, it's that they're powerful. And like anything powerful, they need to be used wisely, especially after 60. Your body changes with age. Your kidneys, your heart, your blood vessels, they don't bounce back the way they used to. A test that felt routine at 40 might carry real consequences at 70. But you're not powerless. You can ask questions. You can slow things down. You can make sure every test, every scan, every decision fits your unique body and health story, not just a checklist from a clinic. Instead of assuming, ask. Instead of rushing, pause. Instead of thinking, it's just routine, think, is this essential for me right now? That shift, from passive patient to active partner, can protect your health more than any single scan ever could. And if you've ever felt rushed into a test, or if something didn't sit right afterward, trust that instinct. Speak up. Ask again. It's not rude, it's responsible. Because being informed doesn't make you difficult. It makes you safer. And if this video did one thing, I hope it reminded you. Your voice matters. Your choices matter. And yes, your health is still in your hands. If you've ever felt strange after a scan or test, or watched a loved one go through something that didn't feel quite right, drop a 1 in the comments. If nothing like that has happened yet, drop a 0. Let's talk about it. Let's learn from each other. And if you found even one part of this video helpful, hit the subscribe button. Because here at Golden Wellness 365, we're not here to scare you. We're here to tell you what most brochures won't. So instead of guessing, you'll know. Instead of hoping, you'll ask. And instead of going through the motions, you'll make every medical decision count. You deserve to feel confident before your next appointment, not confused. That's why we're here.